Switzerland and the United States are both prosperous, innovative democracies, each boasting a high standard of living and a reputation for global influence. On the surface, they share many similarities: thriving economies, world-class universities, and vibrant cities that attract people from all over the world. But when you look closer, their approaches to society's biggest challenges, like healthcare, economic opportunity, and political decision-making, couldn't be more different. The daily rhythms of life in each country reflect these choices, shaping everything from how people work to how they care for one another. Both nations value freedom and high living standards, and both are proud of their unique identities. Yet, the way they define and pursue these ideals often sets them on diverging paths. When it comes to healthcare, trade, and governance, their solutions are shaped by deep-rooted philosophies. The U.S. often favors bold, market-driven innovation and a belief in the power of competition, while Switzerland leans toward careful consensus, stability, and a commitment to social cohesion. The U.S. champions individualism and market-driven disruption, believing competition yields the best results. This spirit has fueled technological revolutions and economic dynamism, but it also brings challenges like inequality and a sometimes fragile safety net. Switzerland, by contrast, prioritizes consensus, stability, and long-term planning, engineering systems to be resilient and fair. Decisions are often made through direct democracy, with citizens having a real say in shaping policy. This video will explore how these philosophies play out in healthcare, trade policy, and governance, using real-world examples, not theory. We'll see how each country's choices impact the lives of ordinary people, and what happens when ideals meet reality. The aim isn't to crown a winner, but to see what each country can teach us about building a better society. By understanding their differences, we can appreciate the strengths and weaknesses of each approach. By comparing their choices, we can uncover lessons that might improve lives elsewhere. Perhaps there are ideas worth borrowing, or pitfalls to avoid, as other nations grapple with similar challenges. Could the U.S. benefit from Swiss-style stability and consensus? Has the American pursuit of market purity gone too far? Or is it the engine of progress? And what can Switzerland learn from America's boldness and drive? Let's dive into the story of two wealthy nations and the very different paths they've chosen, discovering not just what sets them apart, but what they might achieve by learning from each other. Healthcare is where the U.S. and Switzerland most clearly part ways. While both countries are wealthy, their approaches to healthcare could not be more different, and the results speak volumes about the systems they've built. Both use private insurance, but the similarities end there. In the U.S., insurance is often tied to employment, and coverage can be inconsistent or expensive. In Switzerland, everyone is required to buy basic insurance, but the government ensures it's affordable and accessible for all. The U.S. spends over $12,700 per person, nearly double the average of other wealthy nations, yet lags behind in life expectancy, infant mortality, and preventable deaths. This massive spending doesn't translate into better outcomes for most Americans. Instead, it often means higher bills, more paperwork, and greater stress. Despite world-class doctors and cutting-edge technology, the system fails to deliver value for money. Many patients delay care due to cost, and medical debt is a leading cause of bankruptcy. The complexity of the system leaves many feeling lost and unsupported. Switzerland spends less, about $9,000 per person, but achieves some of the best health outcomes globally. Their system is designed to prioritize patient well-being, not just profits or paperwork. Universal access, low infant mortality, and high life expectancy are the norm. Swiss citizens rarely worry about affording care, and preventive services are widely available, helping people stay healthy from childhood through old age. The Swiss model proves you can have a market-based system without runaway costs or poor results. By regulating prices and requiring insurers to compete on service, not on who they cover, Switzerland keeps costs in check and quality high. It's not about public versus private, but about smart design and clear priorities. Switzerland's system is built on transparency, accountability, and a shared commitment to public health. Switzerland emphasizes universal access, cost controls, and efficiency. Every citizen is covered, and no one is left behind due to income or employment status. The U.S. system, by contrast, is opaque, wasteful, and often ties care to ability to pay. Patients face confusing bills, surprise charges, and a maze of insurance rules that can make even simple care feel overwhelming. The Swiss have tamed the market to serve the public good. Their system is proof that healthcare can be both efficient and compassionate, balancing innovation with fairness. In the U.S., The market often runs wild, with devastating consequences. Millions remain uninsured or underinsured, and the fear of medical bills can be as harmful as illness itself. The lesson is clear: more spending doesn't guarantee better health. What matters is how a system is designed, who it serves, and whether it puts people, not profits, at the center of care. Why is American healthcare so expensive? It's a question that frustrates millions of Americans every year, as they open bills that seem impossibly high for even the most basic care. The answer isn't simple, but it's crucial to understand. There are two main reasons: sky-high prices for services and an overwhelming amount of administrative waste. These two factors combine to make the U.S. healthcare system the most expensive in the world, by far. Medical services, procedures, and prescription drugs cost dramatically more in the United States than in any other developed country. Unlike many nations, the U.S. has little to no price control, so hospitals and drug companies can set prices as high as the market will bear. Administrative costs are staggering, over $1,000 per person every year. That's about 5 times higher than what people pay in other wealthy countries. This money doesn't go to doctors or nurses, but to a complex web of insurance companies, billing departments, and endless paperwork. Instead of funding better care, these dollars support a maze of insurance forms, claim denials, and confusing policies. Patients and providers alike are forced to navigate a system that often feels designed to trip them up. The result? Ordinary people face confusion, insecurity, and the constant threat of financial ruin just for getting sick or injured. Medical debt is a leading cause of bankruptcy in America, and many delay care out of fear of the cost. Now, let's look at Switzerland. There, everyone is required to have the same basic health insurance, and insurers are not allowed to deny coverage or charge more for pre-existing conditions. This creates a level playing field for all citizens. The Swiss system is simple, transparent, and designed to serve people, not paperwork. Patients know what to expect, and providers spend less time on bureaucracy and more time on care. Standardization and strong government regulation keep costs in check, making healthcare affordable and accessible for everyone. There's less waste, less confusion, and more focus on health. The U.S. system profits from confusion and complexity, while the Swiss system profits from clarity, fairness, and efficiency. The difference is striking. Smart, fair rules make healthcare markets work for people, not against them. When systems are designed with patients in mind, everyone benefits. Switzerland's Lamal system is a pragmatic blend of private insurance and universal coverage. Every resident must buy basic insurance from private, non-profit insurers, ensuring a large, diverse risk pool. Insurers can't profit from basic coverage, must accept all applicants, and offer identical benefits. The government negotiates prices for services and drugs, preventing price gouging. Subsidies keep premiums affordable for lower and middle-income families. The result: competition and choice, but with universal access and no fear of losing coverage. Swiss citizens enjoy freedom to choose doctors and insurers, with no restrictive networks. While premiums can be high, the system is broadly supported and delivers excellent outcomes. Switzerland shows universal healthcare doesn't require a government-run system, just smart regulation. Trade policy reveals another stark contrast between the U.S. and Switzerland. The U.S. has become increasingly volatile, with tariffs and rules shifting based on short-term politics. A recent U.S. tariff formula ignored trade and services, unfairly penalizing partners like Switzerland. This approach creates instability, as businesses can't plan for sudden policy changes. Switzerland, by contrast, values predictability and long-term partnerships. Their policies are based on comprehensive data, not political whims. Arbitrary trade rules strain alliances and raise costs for everyone. Stability and fairness in trade policy benefit both businesses and consumers. Swiss trade policy is built on stability and a holistic view of economic relationships. Switzerland considers both goods and services, using multi-year averages to avoid knee-jerk reactions. This predictability gives businesses confidence to invest and grow. Swiss trade agreements are comprehensive and designed to last, covering goods, services, and intellectual property. The goal is durable partnerships, not short-term political wins. This methodical approach fosters trust and reliability on the world stage. Switzerland's reputation as a consistent, fair partner attracts investment and strengthens its economy. While the U.S. approach may be more dramatic, Swiss stability is a powerful economic asset. Predictable rules encourage prosperity. The Swiss model shows that quiet competence can outlast headline-grabbing volatility. Stability is a competitive advantage. Swiss political stability is no accident. It's engineered into the system. Power is shared among major parties in a 7-member federal council, forcing cooperation and compromise. No single leader dominates. Decisions are made collectively. Frequent referendums give citizens direct input and act as a check on government. Policy changes are slow and require broad support, preventing wild swings. This consensus-driven model reduces polarization and drama. The result? A pragmatic, solution-focused political culture. Swiss boredom is the foundation of their economic and social stability. The U.S. political system's winner-takes-all nature creates global economic volatility. Fiscal policy swings with each election, making long-term planning difficult. Markets react to political cycles, with uncertainty rippling worldwide. A new administration can reverse regulations and spending priorities overnight. International investors and governments must constantly hedge against U.S. policy shifts. As the world's largest economy, America's political turbulence affects everyone. Protectionist policies disrupt trade and fuel inflation globally. Switzerland, by contrast, offers fiscal calm and predictability. Its independent central bank and low government debt make it a safe haven. Swiss stability shields it from the shocks generated by U.S. political drama. Comparing Switzerland and the U.S. isn't about picking a winner, it's about learning from their choices. Switzerland proves that stability, smart regulation, and collective responsibility deliver real benefits. Universal healthcare, predictable trade, and steady governance create a resilient society. The U.S., for all its innovation, pays a price for volatility and adversarial politics. The Swiss model shows that boring, effective governance can be a strength. For ordinary people, these differences mean affordable healthcare, stable jobs, and a government you can count on. The U.S. could learn from Switzerland's quiet dedication to systems that work for everyone. Sometimes the best solutions aren't the most exciting, they're the most reliable. Stability, fairness, and common sense, that's the Swiss lesson for the world.